For nearly 50 years in Northwest Portland, it's been a safe haven for pet owners.
We are one of the nation's largest ER, ICU specialty animal hospitals, easily from a single location hospital, probably one of the busiest in the country.
Despite those distinctions, DoveLewis is reducing its emergency walk-in hours. After soldiering through the pandemic and keeping the ER open 24/7 for their patients, President and CEO Ron Morgan expected this day might come.
For long-term, health of the organization, for our employees to kind of catch a breath, and for us to kind of regroup on our ability to staff up and get the hospital to where it needs to be.
Morgan says ideally they should have 280 employees, with the vast majority working in the hospital, but right now they only have 185.
In just our ER, the emergency room, we need to have 20 technicians, nurses, and we're down to 7.
So at least temporarily, ER walk-in hours are now 2 p.m. to 10 p.m., 7 days a week. Veterinary teams will still monitor and treat patients in the ICU 24/7, and specialty departments will keep their regular hours. Meanwhile, DoveLewis is focused on filling the empty spots.
We've really, ranked up our recruiting efforts, and we're seeing some progress there. But the veterinary industry in general has a real problem with staffing. It's not just DoveLewis. There's not enough veterinarians coming out of vet school. There's not enough technicians coming out of their tech schools.
As they recruit more veterinarians and vet techs, with plans to do more training at the hospital, Morgan explains the goal is to have the ER back to 24 hours a day in about 6 months.
Looking at this as a way to maybe change the model of how veterinary emergency care is provided.
Upon further search, we did find a few options for owners requiring 24/7 ER care for their pets, from Cascade Veterinary Referral Center in Tigard to Blue Pearl Pet Hospital in Northeast Portland. Now, Morgan suggests being prepared for emergency situations, know the ERs close to your home, and work with your regular veterinarian to come up with a plan. David?
Still options out there, just not as many. Thank you, Alma.